Hello, everyone. I will be presenting on exercise for patients with metabolic syndrome. To give you a quick overview of our patient, Mary is a 62-year-old African-American female non-smoker diagnosed with metabolic syndrome and medically managed type 2 diabetes. We have listed some of her reported signs and symptoms, some of her limitations in environment and home, and her limitations in activity and participation. Based on her presentation, Mary is at high risk for CVD, so it is being recommended that she seeks medical clearance prior to initiating any moderate or vigorous exercise. Rationale for exercise. Overall, exercise can improve the patient's metabolic syndrome and type 2 diabetes and lower the patient's risk of developing heart disease. Some considerations for providers. Providers should have adequate training in cardiopulmonary resuscitation and awareness of effects exercise can have on an individual's blood pressure and heart rate. Additionally, providers should be able to identify signs and symptoms of hyperglycemia to keep patients safe when working with them. Exercise prescription should be based on information from the patient's medical history and health assessment. Taking that into account, due to the patient's past medical history and CVD, conducting treatment in the inpatient hospital setting is indicated. These settings can offer medical resources in the case of medical emergency. Here are some materials that we will be using for aerobic and resistance exercise. For aerobic training, we will be incorporating walking and bicycle rides. For resistance training, we have a variety of exercises listed here, such as side steps, seated marches, and banded shoulder exercises. We are electing for 20 to 24 in-person sessions, 3 sessions per week, and incorporating at least 2 sessions of cycling or yoga outside the clinic. Each session should be about 30 minutes in length and gradually increasing to about 60 minutes around the 7th or 10th session. We will be incorporating resistance exercise to gradually increase and enhance muscle strength and muscle mass of the upper and lower extremities. Some considerations for metabolic syndromes is to focus on risk factors such as Mary's high CVD risk and also taking into account blood pressure, blood sugar, and cholesterol levels. Other considerations, because our patient specifically has type 2 diabetes, it is important to monitor her blood glucose levels and also take into consideration that she may have possible peripheral neuropathy, which will change the way we do our treatment plans. We should also make sure to check in on the patient's RPE in order to address any fatigue she may be experiencing during our treatment and allow for breaks when necessary. We are expecting to collaborate with her primary care physician and refer her to a dietitian. The use of a dietitian with continued PT will lower the risk of CVD and allow for better control of patients' diabetes. Thank you.